Hello, welcome to Voices in Nursing with Dr. Nuzel, Care, Policy, and Leadership. I am your host, Dr. Yolaine Nuzel. Today's episode will be on Health Policy 101, how policy shape your care. Healthcare policy is not abstract. It's a breakdown that legislature and regulatory agencies directly shape what your care is all about and what happened at the bedside, in the clinic, and in our communities. Health policy is determined by quality care, equity, and outcome. As a nurse leader, I understand policy that gives the power and influence care beyond individual patients and drive meaningful system level change. Let's get started. I am bringing you today the former state representative, the Honorable Donna McLeod. Please welcome.
I am former state representative Don McLeod. I served 2 terms in the legislature. I am a mom. I'm also a grandmother. I'm also a chemical engineer. I consult for medical device companies. But I think the most important thing about my life is that I journeyed from Jamaica to Canada. I now live in the state of Georgia. And just to know that anything is possible, and if you set your mind to it. And it's not determined on, what scale it is. It's that you made it possible for yourself. And I think everybody's journey is going to be different. But it's important that we all understand our own value and our own worth. And we often say health, well, if you do not have your health, nothing else kind of matters. You'll spend every dime trying to make sure you stay healthy. So these kind of conversations are important to educate the public, to make people understand that they need to stay engaged and be aware of what things are going on, what policies and laws that are impacting their health.
Thank you for your presentation here in Georgia. So, how do health policy create at the legislation level directly impacted patients every day?
So let's talk about the 2010 law that was passed federal level, which is the Affordable Care Act, often referred to Obamacare. As a state legislator, we, the Democratic side, wanted to expand that Affordable Care Act or actually get it to be accepted in the state of Georgia. And so far, the governor of the state never accepted the Affordable Care Act. Now, you purchase some medical insurance online, marketplace,
Okay.
but the expansion of Medicaid, we've never done it in the state of Georgia. And what has happened because of that is a lot of rural hospitals have closed because they need that money in order to remain in business.
Well,
So you're talking about thousands and maybe even a couple million people impacted by the fact that Affordable Care Act was not expanded in the southern part of the state of Georgia. People often, when I first got here, people would say there's parts of Georgia, there's the metro, and then there's the south. And, again, the south they're not having this resources. What people need to understand is federal dollars come down to the states as well to provide health care. And of course, Medicaid and Medicare are probably, what you just said, like policies or programs that have helped probably some most poorest people in the state of Georgia.
yeah.
A lot of us can afford insurance and pay for it. Even the ones that can't afford insurance now are finding that those premiums are going up. We forget that prior to the Affordable Care Act, pre-existing condition, you wouldn't be able to find any insurance if you had a pre-existing condition. So
Yeah.
basically, it would go to the corner and die someplace.
And I've always have a great concern about patients, family, people who lives in the suburb who cannot get access to care, or the hospital is too far. If they're closing, what are they gonna do?
Like, I have a daughter diagnosed with breast cancer, so she has a pre-existing condition now. Thank God she has a really good job and they're really very accommodating to her, but that's not the case in all cases.
Yeah. Oh, wow. What role do elected officials plays in shaping healthcare? and access, quality, and affordable ability.
Okay, so let me go back a little bit about the political process because I
Okay.
often speak about that because everybody seems there's some people that get involved with the political process and some people that recoil from it and say, I'm not into politics. Once they say they're not into politics, it's very concerning to me because political process, this country is a republic, which means that the people are the government. So the people's voices are the one that must be heard. In order for the voices to be heard, can't all speak at one time. You get to elect someone to be your voice at the table.
Yeah.
That's the whole process of the political process. Then there's the governance part. And what I'm talking about governance is not if you're tall or short, black or white. It's about the fact that money is collected. It's called taxation.
Mhm.
And if anybody knows anything about history, this country actually went to war for taxation without representation. That's the reason why the colonies here rebelled England because they were taking money taxation. So that's why I wanted to step back a little bit so people are aware that elect somebody, that person is going to be now responsible for policy the laws. If you get somebody who doesn't care or they're selfish or they have their own policy and they think they don't need to be worried about yours, you don't want that kind of person as your representative. You want somebody who's going to really look at your life, the people that they're, and talk to you and know who you are so they can make decisions based on the fact that you needed help.
Yes.
And so how policies, the expansion of Medicaid, the Affordable Care Act, is based on who was elected. The governor. The governor did not expand it, and he has the power to expand it, and he never expanded it. So that's why it's important. So anyone who's in elected office, you are responsible for creating policies and laws. On healthcare, it is about money allocated to those programs that help you with your health. And how do you allocate the money? Through your taxation process, right? Collect the money, and then we will decide how that money gets spent. In the state of Georgia, there's many departments. The number one department in the state of Georgia for funding is education, but we also fund the Peach Care for kids, and those are all money that is put based on taxpayer dollars that are put towards making sure that kids have health care up to at least they're 17. So that is why it's so important for people to understand why you need to elect people that will actually create policies and programs that impact your health. Health is wealth. If you don't have your health, you really don't.
And as I was always saying, you have to elect somebody that understand the healthcare system. So they have to be able to understand. And for the people who lay back, who doesn't understand or who's saying that they're not into politics, I can tell you I myself, I might be guilty too, because in the beginning of my nursing career, they would tell me, that's like many, many years ago, they would tell me that as a nurse, you're not supposed to involve in politics. But I found later on that is not true. That is not right. I felt that I was kept in the dark. I was misled then.
In fact, we have a couple of nurses that are elected officials.
Mhm.
And that's the beauty of having diverse voices at the table. I'm a chemical engineer profession, but I'm also a mother and a grandmother. So when I'm going to I'm bringing all of that. I'm also a woman of Caribbean heritage. So when I step into the arena of elected office, I'm bringing all of that with me. So when something comes on the floor, legislation, I'm going to look at it and say, how's this going to impact my grandchild? How's this going to impact my communities, the Caribbean community? If you're not at the table, you're truly on the menu.
Yeah.
Being at the table, you get the pushback. We like to see nurses, engineers, even people that are
Pharmacists.
It doesn't matter if you think that something is missing, a voice is missing from the table, just like mothers coming, being at the table. We elected moms, we've elected women that were young mothers.
Yes.
They're mothers, they have young kids. But guess what? They bring that fact that they are young mothers and the things that impact them as young mothers to the table. So we encourage nurses, anyone, if it does take some time. Yeah, it's about 90 days that you are in session, but you do have to do constituent services over that full year.
Mhm.
But having the voices at the table, the session, actually laws is critical. So yeah, I encourage everyone that they could bring something to the table to run for office.
Yeah. But you work collaboratively with people that want to run, or at least you know that person who's going to run educated enough, knows about healthcare system and how we have shortage in nurses. They say shortage. And I always say we not really have a shortage. It's a crisis that we have, you know?
But I will
So
say this. The nurses come down to the Capitol. You guys usually have a lobbyist or who speaks on behalf of the nurses to make sure that things, when COVID was spreading, it was imperative that the nurses spoke to, because they're the ones that were on the front line, and there were families that wanted to come into to the nursing home, the hospitals, not understanding that nurses are also going to be at risk, but also a patient who's very ill may not even be COVID, but you bring in all that germs that we can't control, all that stuff. Fact that we have to deal with that at the Capitol. Those are the kind of things, as a state legislator, we had an aging department at the time. That committee was the smallest committee, one of the smaller committees that didn't think much about. But during COVID, it became a very large committee, a very important committee, because if people remember what was happening in COVID, was our elderly was dying faster and earlier. That was the first batch of people that were dying.
It was a great experience and I enjoyed it. Just a lot to learn about the politics system. So, how can health policy be used as a tool to reduce health disparities and promote health equity?
Genuinely care about people. To be honest, I grew up in Toronto, Canada, in Ontario, Canada, and we have universal health care. And so if you genuinely want people to be well, you actually make policies to help them be. Everybody has a responsibility to their own health, right, to eat. But also the government can make sure certain things aren't carcinogenic agents, not put in food.
Chemical.
And chemicals. Exactly. Human beings demand a lot of things. And part of being a legislator is actually act as a protector of the people. Not necessarily with standing over them or anything, but creating policies that actually impact them in a good way. Those are all things that policy and laws can prohibit or allow.
When it becomes too much politics, they don't care about what people ingest into their body as long as they're making money.
It's more about money. Mass producing means that a manufacturer is going to make more money because they're going to ship out more things for you to buy. I worked in manufacturing for over 20-something years. Raw material comes in, raw material gets built, the product gets built, shipped out. Obviously, when you're in business, the whole idea is to make the stuff and ship it out and create a higher margin for it to be bought so that you can make a profit. That is the biggest difference between governance and business.
Right.
Business makes a product or a service and charge for it, while government takes your money through taxation. It doesn't ask you, it takes it. So whether you pay income tax or not, you're also paying sales tax, and that's every one of us.
Yeah.
As long as you buy something, you're paying sales tax, and all of that is revenue for the government. Sales tax, your income tax, and fee. And so as a result of that, you are looking at people really demanding or should demand that their value of their money is treated with respect. If you bought something at the store and I buy a pair of shoes and I bring it home, how about I'm gonna be upset. And I'm gonna bring that back. The problem with taxation, you don't always get that immediate thing. That's why it is important to get people at the table to actually be your voice, and you can call them and say, part of the process, you elect someone, but the other part is actually keeping them accountable. Is calling them and saying, hey, this is not working for me, or what's going on? How are you voting on this when it's hurting me? Or thank you for voting on this because it's something that I really want. That's all feedback, and it's all making sure that your elected official know what you want and what you don't want. But again, people don't see it in the same way, because when you get a pair of shoes and it doesn't work and it breaks on you, you'll have an immediate reaction and you immediately do something. People should think of government in the same way. If something is not right, pick up the phone and call or email your elected official. Most people don't do that.
But it's because do they feel like they're not going to get a appropriate response? Because a lot of elected officials, they know once they're elected, like if it's 2 years, 3 or 4 years, they're going to stay that time no matter what.
They're going to have to come back to you again and ask you for your vote. Nobody's there permanently. So every representative is only 2 years. Every representative, whether it's on the state level or the federal level. The only folks that have more than years are usually at the city council level. They get 4 years, and the mayors and stuff. 2 years, all representative. The only people with 6 years are U.S. senators. Every 2 years, there's a primary. So people to understand the primary system. Primaries, the Republicans have a primary and the Democrats have a primary.
Okay.
And during that primary, you will go to in the state of Georgia. Now, there are other states that do things a little different. But in the state of Georgia, during a primary, which is usually in May every year, so that's primary, you go and you ask for a Democratic ballot or a Republican ballot.
Okay.
When you do that, if you do that all the time, you will start being identified as a Democrat or a Republican or even an independent. So if you're a person that says, I'm siding with the Democratic Party for their policies, and you take a Democratic ballot and consistently, then you're a Democrat. But if you're a kind of person that say, you know what, I don't like what the Democrats are doing this time, I'm grabbing a Republican ballot, start becoming what they call an independent.
Okay.
So in the primary, each party, basically people in each of those parties vote for the people they want to see in November. The only race there's two races that do not go into November. That is the judicial branch, so people running for judges,
Okay.
and people running for school board. Finish in May.
So this podcast also is going to be some platforms that can help participants or listeners when to vote, how to vote, and where to vote. I'm a nurse. I'm on healthcare. I'm really interested here because I think in politics, whatever it is, healthcare, it's affecting everyone. Even the politicians themselves sometimes will forget if they can get sick. Where would they find information if that certain policy or elected official is supporting education or is supporting healthcare? Where would they find that information?
So let me first start making sure that everybody check that they're registered to vote. And if you're not registered to vote, register to vote. Go to iwillvote.com. That is
Okay.
iwillvote.com. I can give you the Secretary of State website, which is a longer version, but the I Will Vote will take you to the Secretary of State website.
Okay.
So iwillvote.com. If you're a registered voter, you will go, you'll put your first initial and last name, your date of birth, and the county you're registered in. Hit submit. And if you're a registered voter, all of your information will come up. Where to go vote, your address, how often do you vote, who is your elected official. You can find out all of that on iwillvote.com. If you are looking to see, and by the way, you can find your elected official. So then the next step that I'm telling you to do, you will be able to see how they vote. So you can go to legis.ga.gov, leis.ga.gov, and you can actually go in there, all legislation, and you can pull up your state legislator's name. You can see how they vote on bills. They also have an ability to show you the performance of your state representative. And you can also find out from your congressional representative. Well, you could live in the city limits where you have a mayor and council people. If you live in a county, you might have an elected official who's your commissioner and your chairperson. When you look at the state level, you'll have a district representative, which is a state house representative. I was one of those.
Okay.
In the state of Georgia, the executive branch is the governor. The legislative branch in the state of Georgia has 180 House members and 57 senators. All of us are up every 2 years. And then, of course, in Congress, the state of Georgia is broken down into about 10 congressional district, which is about 760,000 people per. So the state rep district is about 60,000 persons in that. So it's smaller, so it's more granular. Then you go wider, Congress, and you're looking at about 760,000 people. And Georgia is roughly 11 people. And Georgia has a pretty big budget. Georgia has collected taxes at the state level is about 32 billion with a B. And they get additional funds supposed to get the federal government, which totals something $27 billion. So Georgia is almost a $60 billion.
How do non-medical factors like housing, education, and employment influence the policy you support?
Of course,
you see that there's a lot of cutting on education.
Of course, because we have to prepare a society for tomorrow. Homelessness and not having food is stress. And so anyone who's in elected office, our job is to minimize the stress of our constituents, not to increase it, right? So policies are making sure that, like here in Gwinnett County, a lot of the investors are buying up land, buying up the subdivision, and then renting to homeless for like $4,000. That puts the cost of living so high. And I like to break things down to people. If people aren't living in your area that are willing to serve you your dinner when you go to a restaurant like Longhorns or go to Carrabba's or wherever you want to eat, you want somebody serving you because you didn't want to cook.
Yeah.
and you want that
Yes.
service. Well, those people have to live in, especially in Gwinnett County. They need to live in Gwinnett County. Why? Because we don't have any transportation system here. And so it puts a lot of burden on someone who doesn't have a lot of money, but but we are also dependent on them stocking our grocery shelves. So every time we go inside the grocery stores, it's not magic. Somebody has to open those boxes. Somebody has to fill the shelves. And it's usually not somebody making $70,000 a year, but we want that service to be provided. And we also want to make sure that they can in the area.
That's in turn going to affect healthcare.
Of course.
If a nurse cannot go to school or somebody who is interested, we already have a crisis in nursing. And now you're going to cut funding. You're going to discategorize or limited nursing as a profession. So where are you going with healthcare? Where are you going with people? Who's going to be treating those patients we have now, those care attention? What are we going to do
So
on
this
that?
is where I tell nurses and the nurse organization, show up at the Capitol to push back on every legislature, Democratic, Republican, all of them. Their voices need to be heard because not having an educated nurse or somebody who wants to biology. I know this administration seems to be factless. They don't work much on facts and science and data. But those of us that know better, we have to. Our ancestors had to do that on behalf of us. So we have to do now on behalf of the next generation that comes after us. We don't get to have apathy about it because lives are at stake. If people are not understanding how to do things medically, then they could go into a room and kill somebody
Yeah.
and then say, we have,
Basically, that's what they say.
well, it's just like when they did the COVID. We made a law that says we can't hold a business accountable if somebody contracted COVID.
That business,
So they
yes.
can do the same thing. It's just laws. An opinion of somebody. And if that opinion gets enough votes and the governor signs it into law, it's now law. A simple kind of
Complicated.
childish, like say, I don't like the color red. And I get enough people in the Georgia House to say they don't like red. And every Wednesday, you can't wear red because if you wear red, you'll be breaking the law. We get the governor to sign. Can't wear red on Wednesday. Against the law. It's as simplistic as it is. It's pretty simple. And it probably will never happen. But I'm saying that this is how laws get made, right? And I use this reference all the time about the enslavement of Africans. The enslavement of African was legal ownership of human beings because it was a law. It took a war to end that practice of enslaving people in this country. So we need to remember how laws operate and that the states have a lot of power. The states do have a lot of power because it was state law. It took the federal government to go in and there was a civil war.
Did the state use the power that they have? If they have power to make decision, to make changes?
Absolutely. The states
can, they just don't want to?
Depends on who is in the power. Remember, the power lies within the people you elect. So it's not a random thing. The power lies within the people you elect. So it is important to elect people and give them that power to make decisions on your behalf.
So I would like you to advise the healthcare professionals who want to advocate for policy to change, to tell them what to do.
Everyone that's in the medical field or in, I urge you to not think of it as being political, but as being advocates. Advocacy is about making sure that policy gets put in place that benefits what you're trying to do and the people you're trying to serve. Policy is about persuasion, and it's temporary. It's people's running for office, and they're going to try to persuade you to get, your vote. They say in the Georgia House of Representatives, show me your budget, and I will show you what you need. And so if you believe that people's health is valuable, then let them show you budget by advocating for people you serve and for yourself for being in that profession in care of others. I love public service. That's why I've done it, because I certainly was because I got paid a whole lot of money, $17 a year. That's what we got paid.
Wow.
So it wasn't like it was for money. But if you're going to do anything on behalf of people, do it with the intensity and the care
passion.
and the passion, and advocate for what you believe is important. We have people that care, that are willing to stand up. Stop thinking in a political way and think about how do I help to create real policies and real law that serve?
So, if the public understood one thing about health policy, what would it be?
Again, you have to advocate for everything you want. Majority of the legislators are not coming from a health base, right? A lot of them are attorneys. So they're not going to know what is needed unless you tell them. And that is why it's called a representative democracy. You're supposed to tell the people you elect so that they will work on your behalf and put in policies and programs in place on behalf of the people.
So, I'm going to ask you, who's our elected official right now? Who you think's done really onto healthcare, educations, since this podcast is mostly focusing on healthcare, who can give us a voice as a healthcare provider we think we can support as
Okay.
nurses and healthcare providers?
So I will say this. I'm right now helping Dr. Heavenly Times run for Congress, but you've got a variety of levels of government in which you should know who your representative is. That's by going to iwillvote.com. That's iwillvote.com. IWILLVOTE.com. And it will tell you who exactly, because I don't know who I'm exactly speaking to right now. So you could live in Cobb County, Fulton County, Douglas County. I don't know where you might be listening, but iwillvote.com will, if you put in your first initial, your last name, your date of birth, and the county you're registered in, you should be able to find every single person that represents you. In the state of Georgia, the only two people that we actually share the senators, the two senators, that would be John Ossoff and Reverend Warnock. Those are the only two that all 11 million of us in Georgia share. Everybody else, your district is unique. You obviously in your district, you will share the same person who's in that district that represents you. But outside that district, it could be somebody else's district. So it's important for everybody to know who their representatives are and where you can find them. At each of them contact information, emails, phone numbers, they all do. You can call or you can email them. But the most important you need to do is to know who represents you, because they're different depending on a district, but it's important for you to know. And those are the people you will need to call and advocate for yourself if you think something's wrong. I often say knowledge is the most powerful thing you give to yourself, but the vote is the most powerful thing that we give to each other, because at the end of the day, it's the vote. And I'd like to tell people, especially people of color or Black folks, that do not technically have a right to vote. We have an ability to vote because we were amendment to the U.S. Constitution. The U.S. Constitution only gave white men that own land the right to vote. Everyone else has been amended to the Constitution. So the 15th, the 19th, and the 26th Amendment of the U.S. Constitution gave 15 gave Black men, and actually technically poor white, the ability to vote. And then the 19th Amendment gave women the ability to vote. And then the 26th Amendment gave young people 18 years of age and older the ability to vote. So please, please understand that voting is not even a right for all of us. It's an ability. I would love to see eventually that the U.S. Constitution be revised and that's cleared up as a part of the United States Constitution. But right now, it's an amendment to the Constitution. That means that 2/3 of Congress, if 2/3 of people get into office, can get a vote to repeal some of these amendments, can be repealed.
Yeah, thank you very much. Well, Representative McLeod, I know you corrected me earlier to tell me you're a former. To me, you're still representative because I've seen how supportive you are with my other colleagues and nurses that you work with, that you encourage, you support, and I applaud you for that. And I wanted to thank you. When are you running again? Because because you're about all educations, healthcare. I like that. I like that. I really like, because the state of Georgia, I have 130,000 nurses.
They can vote.
If we say we're gonna vote, we're gonna go loud. We're gonna go loud.
I know. I run for office to serve. And what I've found in the last few years is that it's become so convoluted with money, how much money you raise. And unfortunately, a lot of time, if you're raising a lot of money, it's from money from people that want you to do something, get into office. I don't want to be bought. I don't want to be bossed. I want to be served in service of others. So if you're out there and you really want me to run, I think at least I'd like to raise $100,000 just to start Running a race is very expensive. Get your voice out there to tell people what you stand for and what you want to do in service of them. It takes money. It's not free. The mailers, the phone calls, the yard signs, and everybody loves to see the yard signs, but they do cost money. And then your opponent can come around and take up your yard sign.
So really, is that happen?
There's money that people donate to your campaign. So I usually get upset because necessarily the sign is gold, but because somebody's money, they gave me the money to basically for me to be able to express myself and show people that I'm in the race, and then somebody comes and takes it because they think you might be getting more attention than they are. It's about not just competing, because I always tell people you don't compete with anyone but yourself. Only you know how good or bad you are, or if you can do something. So you're not really in competition with anyone. So you always want to put your best foot forward. You always want to be the best you can. You should always be intentional. But again, it is about contrasting yourself with somebody else to say, hey, you do this, but I wouldn't do it this way. And so this is what I would do. That's about contrast. Contrast is different from competing. It's about putting forth ideas.
Thank you for listening. You are listening Voices in Nursing with Dr. Nozil. This episode, if you like what you hear, you can share it with your friend. We are in YouTube, we're on Facebook. And thank you. Until next time, let's lead and let's shape healthcare together.
Nursing is more than care. It's leadership, advocacy, and impact. Welcome to Voices in Nursing with Dr. Nozil, the podcast where care, providers, and policy intersect. Brought to you by GA Healthcare Training and Consulting, an organization dedicated to empowering excellence in healthcare education, leadership, and workforce development. Through real conversations with nurses, educators, patients, families, and healthcare leaders, we elevate voices that inform practice, influence policy, and strengthen our profession. Whether you serve at the bedside, in the classroom, or in the boardroom, your voice matters. Voices in Nursing with Dr. Nozil, sponsored by GA Healthcare Training and Consulting, building leaders, advancing care, shaping the future of healthcare. Nursing is leadership in action. Join Voices in Nursing with Dr. Nozil, where care, providers, and policy meet.